What does an average day look like for an occupational therapist? Well, I'm an occupational therapist, and this is what my average day looks like. First, I start off in the morning with a 5 mile run and do 300 push ups. After that, I wake up from my Fantasyland dream where I'm actually a very productive person in the morning and I scramble out the house as fast as I can in order to get to work on time. So, get in the car, get this seat belt on, and usually it takes me around 40 minutes to get to work. It's a little bit of a drive, but honestly, I love the people I work with. I love the work that I do, and it's totally worth that bit of a commute. Once I get to work, I clock in, sit down at my desk, and it's time to chart review. Going through the patients that I have, I'm looking up, um, kind of a reminder of their diagnosis, a reminder of the treatment plans that I have set for them. If I have a new patient that's come in, then I'll be reviewing that person's chart history, going over why they're there, what they could possibly need, what kind of precautions they're on, if they have a trach, if they were a lung transplant, whatever it is. I'm going to be reviewing that and kind of mentally preparing to go into the room. I'm just looking for anything that stands out through the nursing notes or doctor's notes, if there's any new precautions that have been added, or if the patient had a really rough night according to the nurses where they didn't sleep, anything that would give me an idea of how to change my current plan of how to treat them for the day. Once I've done that, then we head over to the unit and I pick up a patient from their room. Sometimes they're in their bed, sometimes they're already up in their wheelchair. So sometimes the first session of the day is me helping this person get dressed, teaching them techniques of how to get dressed on their own. Sometimes it's taking a shower. Oftentimes they'll need to go to the bathroom, whatever that is. That first session in the morning is usually a take care of yourself type of treatment session. Other sessions throughout the workday are going to be in the rehab gym. We have a lot of robotics that we use. So I would be using some of those with some of the patients, working on some left neglect, doing my Bell assessment that I love to do with people. And then also working on these robotics here. These work on getting more repetition out of people to get more neuro return on their affected side. There's a lot of things we can use these robots for. I'm also going to be working with people just doing some really basic things, sitting at the table, going through pegs. I'm looking at different things. Their coordination, motor planning, can they problem solve, can they follow the directions I'm giving them, etc., etc. After all that's said and done for the day, then go back to the cubicle, back to the desk, and we write up everything that we did for the day. So if I was super energetic that day and created a bunch of very elaborate, fantastic, creative treatment plans, then guess what? I'm going to pay for that at this moment of the day where I have to think up how to write it and explain what I did. After we finish that, guess what? It's time to go home, get back in the car, and now we're flying through traffic on the way home. Every day is just a breeze. And by the time we get home, then it's time to kind of jump into the hobbies, maybe do some woodworking in the garage, just hang out with the kids, whatever it is. Have some dinner with the family and play with the family and start it all over again the next day. I work in a neuro rehab center, so my day as an occupational therapist will look quite different than an OT working in pediatrics or a hand therapist, et cetera, et cetera. So anyway, that's my day in a life as an occupational therapist, and thanks for watching.